You and I talked probably over a month ago when things were really
Mhm.
just starting to heat up. And what I'd love to look at right now is now you've had over a month to be on the front lines and the COVID-19 made it to the United States. What have you learned in that time?
Gosh, there's so many things. Barb, we've learned a lot about the disease, and we've learned, I think, um, where we need to be going. But the biggest part is what we've learned about each other. We've learned a lot about our community. We've learned about people who have creative ideas and are really team players. We've learned how much we can do and how resilient we are. We've learned a lot. We're going forward to see how much curve mitigation we can do as we begin to reopen some of our society, and how well we can manage things until we're able to have real treatment and vaccines out. And I shudder to say that's 2021, but it is. And so we know that as long as our communities are able to continue to meet what we're asking of them, that our society will begin to look a little more familiar and be more functional. If we can't meet that as a community and as a society, then we're going to see a lot more cases and have to shut down again.
What we're doing right now with COVID-19 and what you are having to do as you approach the day-to-day front line, how is that just so different than what you've known?
Mm-hmm. So it's certainly different than everyday patient care, but it's not appreciably different than the other things that we've done in the background that most people didn't know about. And I think that's been sort of an eye-opening thing to me, because I have been taking care of outbreaks of infections in healthcare behind the scenes. And most of the time people didn't want to know about it. They just wanted us to take care of it. Now they're all understanding even terminology I didn't think they could understand. So the conversations are at a totally different level, and having people so much more engaged is really different for me. It got me a little out of my comfort zone at first, and now it's become more familiar. So it becomes a bigger world for me when we're talking about epidemiology now than it
And
was
what
before.
about with COVID-19? There seems to be so much fear. Now, you've treated patients with infectious diseases over the years, and I'm sure they're fearful once they have a diagnosis. But this one we know so little about, that fear factor really must play into the patients you treat.
Not just the patients, but all of us. Now more than ever, I think that knowledge is empowerment. And if we keep giving ourselves the information that we need to be able to function reasonably and to protect ourselves, then you feel like you have some degree of safety. But in this world, all the way around us, there really isn't a complete safe zone, never has been. So this is not particularly different than any other time if you understand what we're asking of each other. But it is something that is a growing base of knowledge we have to adapt to as it goes along.
Just in all reality, there's no crystal ball, but it is going to likely be at least 2021 before we see a vaccine. In the meantime,
Yes.
what do we do?
We do the best we can, one day at a time. That's what we've always been doing, and it's no different than what we did yesterday for today. So we as a population, but particularly in Kentucky, where we're vying for one of the top spots of the best controlled outbreak, need to stay that course. We're getting really good advice. For one of the few times in our lives, we're seeing health systems cooperate and governments cooperate and giving us real information that helps us understand where we need to be. We need to keep listening to that. Just because we're loosening up our society to try to become functional again doesn't mean that we stop all of the precautions that we've been doing. Those are what has saved lives. And until we have treatment and vaccine, it's the only thing that's going to save lives. So I'm relying on our communities. They've been tremendous people, and I'm relying on them to continue to be so, as hard as it is for us, but to continue to be so.